Polk Vision is the leading collective impact organization serving the entire Polk County community. Working on the health of children and adults is their latest project. All the details about how you and your children can get involved is coming up on Polk Place. Welcome to Polk Place. I'm your host, Brian Lacey. Joining us in studio is Worksite Wellness Team Co-Chair Kelly Andrews. She's the Assistant Dean of Wellness at Florida Southern College. How you doing, Kelly?
Good, thank you.
And also joining us is the School Health Team Co-Chair Jenna Kasmarski. She's the Director of Nutritional Services for Polk County Public Schools. How you doing?
Good, thank you. Thank you for having me.
Yeah. Always a pleasure to welcome new folks to the show. Let's talk a little bit about the program. What exactly is the partnership between you and, of course, Polk Vision?
So for the Worksite Wellness team, I'm one of the co-chairs for that team, and basically we've been working on the Building a Healthier Polk initiative for some years now, and so we really focus on the alignment between work sites and adults and getting healthy.
And of course, starting in the schools is also equally as important. Talk to me a little about the partnership with you guys.
So the school health team has been working on an initiative to partner with Polk County Schools and Polk Vision, bringing the alignment process to those schools. They have what's called healthy school teams, and we're looking to help them strengthen those teams to really collaborate within the school and within their communities to promote health and wellness for their students.
So when we break this down, we have two different types of things going on at different times. So let's talk about each program that's going on. Let's start with you, Kelly.
Okay, so the work sites, our goal is really to get into smaller businesses that don't have as much funding or support, such as a wellness coordinator maybe on site. So we're looking at coordinating and helping them to get started. So one of the first steps we ask businesses to do, and we're open to any business that wants to get involved with us, is to go on and do what we call the CDC scorecard, which is basically an online assessment, and it allows them to go in and look at their wellness programs and their policies around wellness to see how they're doing. And from there they can get a baseline, and then from there we ask them if they would like us to come in and do some free consultation and then also connect them with the community. We work closely with the health department as well in providing services. So we have probably about 10 to 12 people that are on our Worksite Wellness team, and we meet regularly. And we have a couple businesses we're targeted that we're already working with. But again, we're opening that up to anyone that's interested in this kind of work. It's free resources.
So when you go into, say, a business, is it exercise based? Is it nutritional? How does it go? How does it work?
Well, comprehensively, we like to focus on everything. So when we say wellness, it's not just diet and exercise, which most people think. We really look at tobacco cessation policy. We look at lactation policies. We look at anything around environmental policies set up in the environment that makes it easy to make healthier choices. So are they providing, say, a gym or gym memberships at discounted rates? Do they have places where people can have a kitchen where they can cook healthy foods or have their stuff stored there? So really a whole environmental approach.
Now, Jenna, when it comes to the school and you guys working with that, how does it work with you guys?
We're starting by partnering with 5 schools, and we are asking them to evaluate their healthy school team and look at the membership of that team. There's actually 10 components of school health that we want them to have included on their team, as well as community involvement on their healthy school team. And then we're asking them over the course of the year to start building that team and working collaboratively on shared goals, because oftentimes they are working on health initiatives separately. So we're looking for them to collaborate together on a shared goal. We're asking them to do physical activity and nutrition during the first year. And then moving forward, we're going to help them build that out to any other goal that they think would be worth, improving the health of their students.
What are some of the things that you're trying to teach the children? What are we talking age-wise, and what are we trying to teach them at that stage?
As part of this initiative, we're focusing on elementary school, so kindergarten or even pre-K at some schools through 5th grade. And we look at things like their nutrition in the cafeteria. So of course we're encouraging them to pick up more fruits and vegetables. We're doing a lot with school gardens. So if the schools that we're partnering with don't already have a garden, we're going to help them with resources to start one. We might also help them improve their garden if they already have one. And when it comes to physical activity, we're looking for ways the school can increase opportunities for students to have physical activity while they're at school. Sometimes they can do before and after school programs, things with safe routes to schools, biking and walking to school, and that type of activities as well.
Now, Kelly, one of the things that we hear a lot when we talk people exercising is body mass index. And one of the things that you guys are pushing for is a specific, let's talk a little bit about what body mass is and what we're looking at and basically where we're at.
Well, our goal, I think our last measurement was 36.9, and we're looking to be at 26.4. I think that's the updated numbers. And so I think we improved a 0.5% over the 3 years of our original.
That's improvement.
Over 3 years initiative, we'll take it. At least it didn't go in the opposite direction.
Exactly.
So that's really what we're looking at. So we really want people to be obviously not in the obese category and not in the overweight category. We want them to be in that range that's healthy.
Jenna, when you're trying to teach kids about being healthy and getting exercise, and this is a generation that has every bit of electronics in front of its face. Talk about some of the challenges that you face in reversing that.
I think it's important to make it fun and engage the students at their level. You know, they don't want to think about being physically active or eating healthy for health reasons. That's not what a young child is usually thinking about. So you find ways to show them that it's fun, help them realize that it makes them feel better and how they can do better in school when they, you know, have more physical activity during their downtime or when they eat better at school. And getting them engaged and really making it fun for them is what we found to be most helpful.
Now, Kelly, she said a key word, getting them engaged, and one of the things that we as adults have learned, we get better with age, not for the Fitbit and of course your watch or your phone to track everything. Talk about how that really encourages the older generation to really get engaged in this movement.
Well, I have to be honest, I didn't get my Fitbit till about a couple months ago, and so as a wellness coordinator, you know, it was a big poo-poo on me. But because I'm somewhat self-motivated, but what I have realized is that, you know, the sleep part and some of the documentation on what I'm eating has made me more aware, like you would with anybody. Right. Well, the sleep piece is important. Yes, it is. So, but you know, technology is technology, and the millennials, they all, you know, they're so far ahead of us, and that's just an expectation. It's not a choice. It's just that's the way that it is. But with the older population, we find, for instance, Harold's, they have Fitbits for all their employees, which was a great, you know, resource for them to put into their program so that they could have their employees wearing these, and it just creates a climate or a culture. And the culture piece is the biggest piece, especially in the work site. You can work with people individually, but if the culture that you're working in is not conducive for people to make healthy choices, it's difficult. So you can have some of these devices, but if everyone around you is eating donuts at every meeting, or, you know, not exercising, or stressed out all the time and not really in a healthy place, it makes it difficult to sort of be, you know, a healthy individual.
It's really cool because the county has gotten us involved in the Vitality program. So, and then every few months we have, you know, challenges to where different divisions go up, and we just finish one, and it's the whole competitive nature, and it really isn't competitive, but it's engaging everyone to get involved.
And there are a lot of platforms now, a lot of external businesses, third parties come in and try to sell you those kinds of incentive programs that are usually technologically advanced. So for instance, at Florida Southern, we have Virgin Pulse, which is part of our insurance company, where you can challenge people like you're saying, and it does. It creates camaraderie around something that's fun for people to do, and those that are competitive love it, right? They're challenging you once a week, every week. It's like, okay, come on, give me a break. But people get into it, and it's positive.
I am such a challenge junkie. It's crazy. Jenna, if you could inspire parents to probably take a more active role in their child's health, how would you do as such?
I would encourage them to talk to their students about what they do when they're at school, because oftentimes they have fun programs or they're eating things at school that they might not realize that they like. We serve a lot of fresh fruits and vegetables, and a lot of parents are very surprised to find out what their kids will eat, and so I encourage them to really have that conversation and talk about what they might want to eat or what they want to do, and involve them in those decisions, and try to get active and eating healthy as a family. I think that's really the critical piece, is that they do it as a family and do it together.
And Kelly, speaking on our generation and those around us, how would you inspire those that have never really kind of taken, just kind of, rode the wave out? How do you inspire those?
Well, I think small steps. People tend to, when you first start talking about change, whether it's exercise or diet or stress or whatever, people try to change everything at one time, as opposed to saying, okay, maybe today, maybe this week, maybe this month, maybe the next 6 months, I'm going to start to exercise. Instead of trying to exercise, change my diet, sleep more, work on my stress level. So we really try to take small bites and small steps and do goals that are realistic and more short term, so that you can create some confidence and some enthusiasm around that.
Well, Kelly, Jenna, I really appreciate you guys coming in and sharing the time with us and all the information, and look forward to hearing about the progress in the coming months.
Thank you.
Thank you.
Polk Vision invites you to join them for Building a Healthier Polk project, which includes Every Kid Healthy Week, April 24th through the 28th, and May National Employee Health and Fitness Month. Building a Healthier Polk is a group of community partners brought together by Polk Vision, who have been working on the goal of reducing the obesity rate in Polk County. Primary care, school health, and worksite wellness teams are all currently creating and implementing tactical plans to improve the health of Polk County residents, and are working towards the long-term goal of reducing the obesity rate in Polk County to the state average 36.9% to 26.4% by the year 2030. Now, if you need more information about how you can join them, give them a call, 863-940-2888, or look them up on the web at polkvision.com.